and gentlemen, welcome to Global Health. This is your host, Dr. Yavuz Selim Sılay. I promised you to bring people from all walks of life. Today, I have one of the top internal medicine and nephrology specialists, the chairman of one of the most important hospitals, Ankara Bilkent City Hospital. He is really doing an amazing job, training many physicians, fellows, and really bringing the Turkish medicine to the next level. Dr. Fatih Dede, he is the professor of internal medicine and nephrology. He is at AFROTURK TV with us. As you know, Global Health is now reaching to more than 1 billion viewers in 49 countries. And he kindly accepted our invitation. We are very, very excited to have Professor Dr. Fatih Dede with us. Dr. Fatih Dede, welcome to AFROTURK TV. I am very excited to have you, frankly speaking. And I know you very well. But for our viewers, who is Dr. Fatih Dede? What excites you? What motivates you?
Yes. I am a Turkish internal medicine and nephrology physician and the director of the nephrology clinic at Bilkent City Hospital, Europe's largest hospital campus. I also hold a key position in the development of health technologies in nephrology at the Turkish Health Industries Presidency. I lead numerous international drug development projects named as FAST studies. I am also responsible for kidney transplantation, home hemodialysis, and peritoneal dialysis at our hospital. I serve as an educator in dialysis and organ transplantation, particularly in countries within the Turkish republics in Asia, exploring new fields, participating in the training of young physicians, and helping others is quite exciting.
This is truly an honor for us. I mean, you have done so much when we look at what you have achieved in terms of training, in terms of educating, in terms of decision maker. This really excites me, and as AFROTURK TV, having you is really a special invitation to us. I know you, but I'm very curious. Why did you choose this field, Dr. Fatih? Why?
Yes. Medicine is evolving towards more examinations and advanced imaging methods today. Nephrology remains a branch where the art of medicine, close patient contacts, and clinical judgment are promoted. Interventional nephrologic procedures and organ transplantation are motivation areas.
Indeed, this is also very important for Africa. You know, all these nephrological diseases and organ transplantation is a key area. I had the opportunity to work in organ transplantation in the United States as well. So this is truly amazing. You know, as a nephrologist, what diseases do you treat and what diseases do you prevent? This is a very important question for Africa.
There is a rapidly increasing problem of chronic kidney disease worldwide. Because of lifestyle changes, increased technology, sedentary behavior, a lack of physical activity, and the consumption of processed and additive-containing foods, diabetes, hypertension, and obesity have increased. As life expectancy increases, cancer cases have increased, and excessive and indiscriminate drug use is widespread. All these factors pose serious risk for the development of chronic kidney disease. Globally, including in Turkey and Africa, approximately 10% of the population has at least one of the following risk factors for chronic kidney disease. Unfortunately, in cases where early diagnosis is not possible, the need for organ transplantation and dialysis becomes inevitable. This not only reduces quality of life and lifespan, but also leads to significant costs.
Indeed, the cost is huge, and when we look at what is Africa doing in terms of the number of kidney patients, I think this is a very important area. So, for our viewers, can you please tell why is your expertise important for Türkiye as well as Africa?
Yes. It mentioned that chronic kidney disease is a very common disease. This also applies to Africa. The most important problem here is the very low awareness among society and healthcare professionals. Africa also carries higher risks of limited access to clean water, genetics, and high rates of infection disease. Based on my observation, support is also needed for the prevalence and quality of organ transplantation and dialysis procedures. I know that screening efforts are being conducted in many African countries for chronic kidney disease. However, there appear to be economic challenges and infrastructure issues related to reaching the correct diagnosis. First, the correct diagnosis must be made. This is actually very simple. After the age of 40, any patients with knowledge of the disease I mentioned earlier can easily diagnose chronic kidney disease by simple measuring blood pressure, performing a urine analysis, and basic kidney function blood tests. Ultrasound is also including to confirm the diagnosis.
Amazing. I think these are really important points for our African viewers. I am truly grateful, Professor Dr. Fatih Dede. And clearly, I think there are many important key points you're making here, which is impacting the decision makers in healthcare across Africa. I'm willing to travel with you to Africa, inshallah, in the future, and really visit them and see what expertise you can provide to our healthcare decision makers across Africa. I'm very pleased with this episode. I'm really appreciative of what you have done for us in your limited time. For our African viewers who are watching right now, I have a viewer now just joining from Nigeria, sending some messages, as well as from Ghana and Senegal. What messages would you share with our African audience who are watching you right now?
Patients at risk for chronic kidney disease should definitely visit a health center and undergo the simple test I mentioned earlier. Salt consumption is a separate issue.
Absolutely.
We must reduce salt intake. Excessive salt is harmful to the kidneys and overall health. We should drink plenty of clean water, eat natural unprocessed foods, and get regular physical activity.
Amazing.
These simple habits can help prevent kidney disease and protect your overall health.
Thank you so much. I think these are very important take-home messages. Decrease salt consumption. Also, increase the plenty of water that we want to drink, as well as eat natural unprocessed food. These are great take-home messages. Thank you very much, Professor Dr. Fatih Dede. I'm truly happy that you were our guest at Global Health. Thank you very much.
Thank you very much.
Ladies and gentlemen, I had an amazing leader, a trainer, as well as one of the top experts in internal medicine and nephrology, Professor Dr. Fatih Dede with us. He travels around the globe and educates people from Azerbaijan to Africa, and hopefully in the future, who knows, maybe I'll be with Professor Dr. Fatih Dede in Nigeria or Senegal or Mali or Ghana visiting you, and also supporting the amazing African brothers and sisters who are really open to transfer of healthcare, transfer of knowledge, and really we want to support Africa because we believe African solutions for African problems. With that, this is Dr. Selim Salai finalizing our Global Health Show. Take care and all the best. Bye.